Good day, everyone. Dr. Ibe, and welcome back. I had a call yesterday from a lady who wants to know if if a lady diagnosed with gestational diabetes can then become diabetic in future. Um, Gestational diabetes is the diabetes we diagnose in women who are pregnant, usually from 24 to 28 weeks or so. That is when it's diagnosed, and it is much more common in obese ladies, ladies who are obese before pregnancy or during pregnancy. It's common in Afro Caribbeans, in the Black ethnicity. It can be common as well in Asians too. And when there is a strong family history of diabetes, that can happen as well. Or if you've had it in the past, if you've had this gestational diabetes in your previous pregnancies, you can have it in subsequent ones as well. And the answer to that is yes. The lady, may go on to develop diabetes, unfortunately. During the pregnancy time, if you're being diagnosed with gestational diabetes, you're being monitored regularly by a diabetologist and your midwife, and you're being checked, dietary advice, lifestyle changes, and sometimes you may be given medication as well during that period. And sometimes after pregnancy, that can reverse, that can stop, and sometimes as well, the diabetes unfortunately may continue after the pregnancy. And indeed, if it's reversed, if it's stopped after the pregnancy, you are being monitored regularly every 6 months, every year, to make sure that you don't develop diabetes. Okay, yes, that can happen sadly in future, even though it's reversed. And there are reasons why women develop that, because during pregnancy, due to the hormonal changes, your body may then become resistant to the insulin. Therefore, you have this gestational diabetes. And I think when I talked about diabetes robustly in the past, I mentioned, but I'm not too sure though, of another group known as those at high risk of diabetes, patients at high risk of diabetes. These are people either during a routine health check, routine blood test, we find out that when the blood result comes back, their HbA1c in a simpler language is just like the hemoglobin that carries the glucose around. The guideline says it has to be lower than 6%. So if your one is between 6% to 6.4%, irrespective of any other symptoms, you are known as somebody being at high risk of diabetes. Between 6% to 6.4%, you are at high risk of diabetes. You're not diabetic, you don't have any symptoms at all, but you may be at high risk of diabetes if not properly checked. So you are being advised on dietary lifestyle, exercise, trying to lose the weight, and sometimes you are referred to the diabetic clinic for advice on diet changes, exercise levels, and so forth and so on. It is only when that HbA1c is more than 6.4%, for instance, if it's from 6.5% onwards, then you are known to be diabetic without any symptoms. So, yes, we also do these checks to prevent that diabetes from happening. So, we have these two categories: gestational diabetes, which is the one during pregnancy, which can resolve after pregnancy, which can continue, unfortunately, after pregnancy as well, and they are being monitored regularly too. Or those at high risk of diabetes, whose HbA1c is from 6% to 6.4%. These are those at high risk of diabetes, and it's very, very common. It's very, very common indeed. Most people don't know it. The only way you can find out is going for the blood test. Check for HbA1c. HbA1c is called. It should be lower than 6%. It should be around 5.7, 5.8, 5%. If it is more than 6%, from 6% to 6.4%, you are at high risk of diabetes, irrespective of any symptoms at all. Okay, you're monitored regularly every 6 months or every year indeed. Lifestyle changes, dietary advice, once again, reducing your alcohol intake. And yes, I felt I just discussed this with us. Once again, please take care of yourselves, your family members, your loved ones. Be good and play safe. God bless. Bye.